And how is it being a midwife? What's this? Welcome to Health Link. That is First Baptist Ghana, and that is the health section. And as you always say, your health is your wealth. Your health is your wealth. When you are healthy, that is when you can even think of acquiring wealth. So please, let's take good care of our health. So with me this evening is my lovely midwife, Mrs. Mabel Ojediran. Auntie Mabel, welcome.
Thank you.
How has your day been?
It's been good. We thank God.
Okay. We thank the Most High God. Yesterday was International Midwives Day, and how is it being a midwife? What's the experience? How has it been?
It's always a joy of a midwife because we get the fruit of the work that we do, because it's always a joy of a midwife welcoming a new baby into the world, and then the mother also seeing the mother healthy and sound. It's always the joy of a midwife, and I really love the profession that I'm in.
So what is your advice to the young ones who want to be nurse, either a nurse or a midwife? What is your advice to them?
Midwife, being a midwife is a lovely profession, and I will encourage each and everyone who want to join this profession to come and also know that it's service to mankind, is service to God.
Yes.
So it involves a whole lot of devotion, patience, and you have to care for your patient no matter what the situation is.
Okay. So those of you who want to become nurse and midwife, please don't be afraid. Come and work for God and then for mankind. Okay, so tonight our topic for this evening is infertility. Infertility. I know one way or the other you might think that, oh, me, I have 3 kids, so what do I need to listen to this show or this topic? Maybe you might be fertile, but you have somebody who is infertile. So if you listen to this program, you can also educate them. So Auntie Mabel, what is infertility?
Infertility can be described as couples who have not been able to get pregnant after carefully timed unprotected sex for 1 year. We could consider those couples as being infertile.
So after 1 year, if you are not able to bring forth, that means you are infertile.
Yeah, if you live with your partner for a whole 1 year, you've had unprotected sex for a year, we can be considered as being infertile.
Oh, okay. So do we have types of infertility?
Yeah, we have 2 types. We have the primary and we have the secondary infertility. The primary is for a couple who have never been pregnant before, not on any contraception method or anything for a year, but they've tried all means, unprotected sex, and they are not getting pregnant. Those people can be considered as being primary infertile. And then the secondary one is a couple who have had pregnancy in the past years, but now they are not able to get pregnant again. So those people are considered as being secondary infertile. So if you've delivered about 10 years ago or 5 years ago, you are still searching, please, up till now you are not getting pregnancy after trying all means, meaning there are signs of infertility.
Okay. So what are the causes? Why would somebody be infertile? Why? What is the cause?
Okay, there are some factors, but I would like to take it, I want us to handle it as the men and that of the women. So I'll start with the men. There are some factors which can bring about these issues of infertility and all those things. For the men, one, I can talk about some low level of some hormones, that the main hormones that helps in producing the sperms. If there are, I don't want to be so medical, so I wouldn't mention the hormones or those stuff, but if there's inadequate hormonal level of these hormones, it can bring about infertility. And then, you know, for a man to for me to say a man is fertile, he must be able to produce sperms well. So if a man is not producing sperms well, which means he's showing signs of infertility. And then the amount of sperm that the man needs to produce, and then even the shape. You know, sperm, they have shape, so the shape of the sperm itself, if it's not well shaped, is a problem. And then also the movement of the sperm. So how the sperm moves, the amount, the shape, and then the amount. Have I said about all those things? If there's a defect in it, which means the man is showing some signs and things. But there are some other causes too, medical causes. If a man has retrograde ejaculation, instead of the man releasing the sperm through the urethra to be deposited into the cervix, but this time around, instead of the sperm coming through the urethra, it goes back into the bladder. So the man is not able to release the sperm. So which means it's just water.
Okay.
So just a little amount, and if it's just a little, you need some amount of sperm for fertilization to take place. And so if the sperm is returning back into the bladder, there is no way there could be fertilization or something. And then also I can also talk about varicocele, or swelling of the covering of the testicles, if there is some swellings there. And then also we can also talk about, there are some men who also have antibodies that fight and destroy the sperms. So if you have a condition like this, you have an antibody that is fighting against your own sperm, there is no way you can be fertile. And then also, if there is there are some tubules where the testicles are. So in that tubules too, if there is a blockade or something, also there is no way a man can be fertile.
Oh, okay. So that are the causes of infertility. Oh, okay. So do we have any risk factors?
Oh yes, there are some risk factors, such as a man, those who age can be a factor. There can
so what
also
is the age range?
The thing is, you know, when a man is aging from 40 and above, because for a woman, I know from 40 years, even if you want to do IVF, they won't do, because they say your ages are over. But some men can be 70, they can still produce sperms. Because I know of a man who is about 70, 80, who is still producing sperms. So it depends on each and every individual. But I want us to also know that there are some couples, we cannot find the cause. Unknown. We can't always find the cause. Yeah. So old age, men who smoke, those who taking alcohol, high consumption of alcohol, and then we also have those who are exposed to hazards such as toxins, herbicides, pesticides. Yeah, those people too, they are prone of, we're saying that they are also prone to being infertile.
Okay. So what are some of the signs and symptoms of infertility?
In men, I can say if a man loses the desire, if he has pain, if there is pain, if the man begins to show signs of erectile dysfunction, and then if the man is not able to ejaculate well, yeah, those are some of the signs that can be seen.
Okay. So do you have any prevention or management of infertility?
Oh, yeah, there can be early. If you seek medical attention early, I think it's better. But in the house, there are certain things you can also do. You can watch your diet. You eat well. You eat foods that are high in fiber. Then you reduce your fat consumption, because if you are obese, if you're overweight, it can have effect on you. You also being infertile. So it's better we eat foods that are rich in fiber. We must also exercise. We should have time to rest. We should also have I've said about rest, right? We should exercise, and then we should also, those who smoke should also quit smoking. Yeah,
and
because and then alcohol consumption too. They should stop consumption. Then we'll talk about the women, because most people think infertility, women is the problem, but women, the most in women, the major cause of infertility pertains mostly to ovulation. So if you're a woman and you are not having regular menses or absence, you are not seeing your period, or you are not having regular periods, which means there is a problem with your ovulation. So as a woman too, if there is a problem with your tubes, because the tubes is where fertilization takes place, so if there is a problem with your tubes, there is infection, we have pelvic inflammatory diseases. So if you have infections and then other sexually transmitted diseases, so if you have these infections, definitely your tubes can be affected. And then if there is a blockage of your tubes too, there is no way fertilization can take place, so which means such a woman cannot deliver. Then if there's a problem with your uterus, we have some conditions like endometriosis, where the lining of the uterus is outside the uterus. Okay, so if there's fibroids too, because if the fibroid is taking over the whole uterus, there's no way a baby can embed. So if there are fibroids too, it will be difficult for embed. But there are some women who are able to get pregnant even with the fibroid in. That is, it depends on how the fibroid is situated, or how big or how small it is. So if they have, and then previously if you had a surgery in your uterus or something, the scars of the previous surgery too can prevent woman from getting pregnant.
Oh, I see.
Yeah, because scars of previous surgeries can also cause infertility. Yeah. And then so women, what some signs a woman can see is if you are having pain during sexual intercourse, it will be difficult for you to take seed.
Wow, just pain. How?
Yes. You know, if there is infection and it's not well treated, definitely there will be pain.
Okay. Yeah.
And there are some women too who have some pains are such that they can't control it. You know, there are some pain you can control, like at least with management, but there are some women who have severe pains. If you're having such severe pains which is detrimental to your health, it's relating to your pelvis or something, you need to seek medical attention. And then women, if you think there are some women who have sexually transmitted disease like chlamydia, gonorrhea, it's better you treat yourself than you treat, and if you've infected your partner too, you treat yourself, because if you treat yourself alone and you don't treat your partner, it will be difficult for both of you to also get pregnant, to achieve a pregnancy or something of that sort. And then also, if you have fibroids, if you're having abnormal bleeding and all those things, you should seek medical advice, so that in case there's fibroid or something, if there need be that surgery be done to take it off, for embedment to take place, it will be done earlier. So in all these things that we are talking about, it's better we seek medical attention earlier. If you are seeing some of these signs, abnormal bleeding, if you are there and for months you are not, as a woman, there are times when you are under stress, your menses might not come, or you do a heavy tedious activity, your menses might not come. But you are a woman, you know that every month you must menstruate, and you are not on any contraceptive or something. You are a woman, you see that 2-3 months you are not menstruating. No, there's a problem. You must go to the hospital, or you report to your the nearest facility, then they attend to you, because early detection and treatment is better than staying for long. So if you've had pregnancy before, if and you think, no, I'm seeing some of these signs, or it's better Because when you go to the hospital, they will run some investigations. For a woman, they will do pelvic test. They will do hormone analysis. They will do the hormone analysis to see if you can deliver. So if you can't, they will look for another option for you. Thank God there is IVF now. Although it's expensive, but if you try all means and it's not working, fine, there is God. Yes. But medically we can do other things. So I think it's better we seek early treatment and then we watch our diet. Women too, there are some multivitamins you can take. Some take folate, that is the folic acid or something. Drugs that are rich in multivitamins too. You can eat high fiber, that I said. Then you reduce your fat consumption, because if you put on excessive weight, overweight, and then too much underweight too, it can be a problem.
So how can that be a cause when you are overweight?
When you are overweight, you know, your system, the way your system works, if you are obese, that is why you are always advised to exercise so that we are not overweight. You check, and then your diet, the fat, if you consume a whole lot of fat, definitely you'll be obese. If you are eating junk food, you'll be obese. You put on weight, and it's detrimental to your health. You are building much fat, and we don't need the fat. That is why we are even advising that if you want to get pregnant, you have enough to rest and then exercise to burn those calories and all those junk foods we eat. So we must eat healthy, stay healthy, and it will be good for us.
Oh, okay. I think I've learned a lot. Aunt Mabel, is there any other thing to talk about when you talk about infertility?
I think if you think you trying your best, pregnancy is not coming, as I said earlier, it's best you seek early treatment. If you are seeing any signs, you are not, as a woman, you think you are not bleeding as you are supposed to, if you are not seeing your menses as you should be, please, it's better you seek early treatment. And then also, if you think you are on certain drugs, some women and men are abusing drugs now. Taking so much excessive intake of aspirin and then brufen too can have an effect on you. Certain drugs. That is why we are saying that those who are on chemotherapeutic and radiation drugs, they have signs of showing infertility because of those radiation and those chemotherapeutic drugs. And then the reason why some men also don't take the hypertensive drugs is that it makes them infertile.
Oh, okay. Yeah, that is a side effect.
Yes, they said they are the calcium channel blockers. That is why most men don't take their hypertensive drug, because it makes them infertile. But it's better to take your drugs to be healthy too, than to say that because I'll be infertile, so I wouldn't take I
think with the obesity and then the infertility, there was a platform I was, and then somebody testified to that. She said she decided to lose weight because she was obese, and then I think 3 or 4 months after, she realized she was pregnant because she was infertile, and then she was pregnant. And as we always say on this platform, we don't encourage over-the-counter drugs. If you are sick, you can take your paracetamol maybe for just a day or 2, and then you go to the hospital. It is best to always go to the hospital. It might be more than what you are even thinking of, but you just take aspirin, take this, take that, take a lot of drug, which rather complicates the situation. So please, we are begging you, the hospital is your friend. Don't be scared of us. We are not monsters. And Mabel, why do they fear coming to us? We are not monsters. We are there for them. So please come, and we will receive you all. Okay, Auntie Mabel, is there any other thing to talk about when it comes to infertility? I think you've tackled the prevention, right?
Yeah.
So can you talk more about the IUD?
Intrauterine device.
Yeah.
That one is pertaining to family.
No, sorry, IVF.
IVF. Oh, okay. That is the in vitro fertilization. That one is a different topic, but
Yeah,
you just want
just
me
something small.
Oh, okay. That one.
I know it's about couples who are not able
to get pregnant by themselves. What they do is they go to see the gynecologist. So this gynecologist depending on the state. If the woman has a healthy uterus, so what they can do is they take the sperms of the man and then the eggs of the woman, then they do what? They fertilize it outside, then they push it into the uterus.
Okay. I learned it's expensive.
Yeah, it's very expensive. But if you get a good doctor, it's time consuming too.
Wow.
But if you get a good doctor with patience and by the grace of God,
It's going to work out well.
it
Okay.
works out, because I have known some people who have gotten triplets, twins, others singleton.
But would you encourage herbal treatment?
I wouldn't encourage herbal treatment, but some people think herbal treatment do not have side effects. But so far as there are medical treatment which has side effects, herbal treatment will have side effects.
Yes.
Because the preparation, you don't know how the person prepared it. With medical treatment, you know the amount you are taking. But with herbal treatment, they will tell you to just take 1 cup. But 1 cup will depend on my cup that I'm using in the house. And then you don't know what they are using to make this thing. So I wouldn't encourage herbal preparation. I believe if you have any issues concerning infertility or fertility or something, it's better you seek medical attention.
It's better
To seek
you
medical
seek
attention.
medical attention. That is all.
And during situations like this, you have a whole lot of doctors, home doctors in the house who be advising you. Oh, I
Do
did
this,
that.
do that.
This person did this, and it worked. So you must also do. But we are different individuals. I might take something, it will work for me, but you will take it, it won't work for you. So I always advise that in case of anything, go to the hospital, see a doctor. If the doctor examines you and tells you you are good, then you know when you are sleeping. But if you go and seek herbal treatment, you don't know. It might even end up destroying the pelvic cavity. And there's a whole lot of delicate organs there. And if there's a problem with your pelvis, reproductive system, there's a problem. There's a problem with your reproductive organs. It's a whole lot of issues. It's difficult treating.
Oh, okay. So I think Auntie Mabel has educated us a lot on infertility. But in conclusion, she said, please go to the hospital. Enough of my grandmother said, enough of my neighbor said, enough of this, because Auntie Mabel, I think that can sometimes even cause them more harm than good.
Yeah.
Because by the time they finish taking all those concoctions, then things have just gone wayward, and then they come and there's nothing that you can do. So I think your last word to our viewers.
Infertility can be treated if reported early. They'll run investigations. If the doctor runs investigations and there is hope, definitely you'll get pregnant. So don't lose hope if you are a primary infertility, you are within the primary infertility or secondary infertility. No, don't lose hope. There is more room. So I'll suggest that you seek early medical attention. If you are put on any medication, you complete your medication. And in case you need to do a follow-up to the hospital. And I think we will all be free.
Do a follow-up to the hospital. Very, very necessary. So this brings us to the end of our program for this evening. Auntie Mabel, thank you very, very, very much. We hope that we know you have a tight schedule, but we'll still call you. Now and then, I'll do that. So lovely viewers. So that has been our program for this evening. We'll come back again same time next week. Don't forget that your health is your wealth. Good evening, and then bye-bye.